Hey there, and welcome back to our small talk. In our last episode, we roughly discussed the pelvic ligaments and their role in achieving pelvic stability, either rotational or vertical. Today, we will apply what we have learned from the last episode of pelvic fractures. But first, we need to ask ourselves, what is a stable pelvic ring? A stable pelvic ring injury is when the injured pelvic ring can still withstand the normal physiological load without deformation, while an unstable pelvic ring injury cannot withstand the normal physiological load. Now let's put those basic concepts into practice. For example, open book pelvic injuries, which are a type B in the TILE classification or type APC in Young and Burgess classification. But don't worry, we have not talked about the classification descriptions as of yet. We will dig into them very soon. So, in open book pelvic fractures, there are three stages. In the first stage, the symphyseal ligaments are only disrupted, leading to symphyseal diastasis less than 2.5 cm, while the sacrospinous, the sacrotuberous, and the posterior sacroiliac complex remain intact, which actually means that the pelvic stability remains unchanged. Now, in the second stage, the sacrospinous, the sacrotuberous, and the anterior sacroiliac ligaments are ruptured, which means there is a rotational instability of the pelvic ring. In the radiograph, you can see symphyseal diastasis more than 2.5 cm and a posterior gap of fracture. So we have symphyseal, sacrospinous, anterior sacroiliac ligaments ruptured. So this means that there is a rotational instability, exactly. But if we look at the posterior sacroiliac ligaments and the interosseous ligaments, they remain intact. So the pelvis is still vertically stable, rotationally unstable. Moving on to the third stage, the posterior sacroiliac and the interosseous ligaments may be completely ruptured, causing a complete loss of pelvic stability, which is no longer considered a simple open book injury, as you now have both rotational and vertical instability. That's it for today. Hope you like it. Stay tuned for more to come.